All right. I am thrilled to bring back to the show Dr. Laurie Bruce, clinical psychologist, mindfulness coach. For the last 25 years, she has been providing psychotherapy, consultation, and supervision to thousands of clients and students. And one of her greatest joys is providing psychological and emotional support to other healers, to therapists, physicians, teachers, and anyone who finds themselves in the position of caring for others. And Lori, this is why I'm so excited to have you on because I know that all of our listeners are like, oh, that sounds like me. I would love to hear what she has to say. So, welcome.
Thank you, Lindsay. It's so good to be back. It's so good to see you. As always, you and I have been connected and friends for many, many years. So it's always good to be with you.
Yes, and this is how I picture us. It's funny to see us on Zoom because I think even with our other interview, we were more side by side. I don't know. I just feel like to see you again this way is like we used to share, well, didn't share an office, but we were side by side offices. And I miss my little walk over to your office and sit
Yes.
down and chit chat time. So
Yeah.
we'll get it today, except I'm going to utilize your wisdom today, if you don't mind.
I'm excited. I'm ready. Bring it on.
Okay. Well, I love that you have revamped and kind of relaunched this podcast, and it's called From Both Sides of the Couch. And I'm loving this because we're getting this therapist view as well as the therapist getting therapy view. And I think that this is such a vulnerable, amazing space to be able to like be that fly on the wall and listen in on your experiences and how you would be coaching or counseling. And I would love my listeners to continue once you and I are done today to go to your site and binge on your episodes because if anyone has ever been nervous about therapy, you bring them into a different space and allow maybe just that little glimpse of maybe this could be for me. Maybe this really would help me in my journey. So thank you for launching this.
Awesome. Thank you. I appreciate you. It was lovely description of really what my intention is with this. As some of my listeners know, I've been through a major transition in the last year, and I felt like it was really important for me to transition my podcast and my brand and my focus. And I spent a lot of time really thinking about what do I want to do in this next phase? And I love all things therapy. I feel like it's something that I can confidently say I do well. There are not a lot of things I can say that I do well, but I think therapy is really one of those things. I've been providing therapy for a long time. And I just love talking about therapy. I love learning about therapy. And I'm one of the things that I've also learned about myself as a therapist is that I tend to be very transparent with my clients, sometimes maybe even more transparent than other therapists are. We learn a lot about the concept of boundaries and self disclosure and making sure that we have healthy boundaries with our clients, of course, always, and that if we're going to engage in self disclosure with our clients, that it be for a purpose, it not be just because I want to talk about myself, that it actually is for the benefit of the client. And I think that's something that is really important to me is to be honest, transparent, and vulnerable in order to help my clients see that so much of what they're experiencing is normal. It's just part of being human. And so when I thought about doing this rebranding, I really thought about so much that I've learned as a psychologist, but also so much that I've learned just from my own therapy. I love being in therapy. Like I really, really do. When else do you get to just sit for an hour and just talk about yourself? I mean, of course, there's just really no other space for you to do that, to do it without guilt. And I just love being in therapy. I'm very introspective. I love learning about myself and how I tick. So I've learned so much from my therapists. And I thought, maybe it would be helpful for people to kind of hear both sides, not just from me coming from this position of I'm an expert, I know, but also coming from this position of, hey, I don't know what the hell I'm doing. I'm making it up just like everybody else. And I am a client in therapy, and I've learned so much from some really, really amazing therapists that I've had over the years. So that's hence a
Yes.
long version of how I came to this new concept, and I'm really enjoying the process.
No, I think beautifully said. And thank you for going through that journey because it really helps bring us along. In this piece of it, again, I'm just going to really hone in on one of my main goals of talking today is my hope would be one listener would reach out and consider therapy because of vulnerable conversations, because of professionals saying, I don't know it all. And I'm learning too. And I grab coaches, I grab personal trainers. I am a personal trainer, I'm a coach. I'm with you. I think it makes us better as the provider when we have sat in the other seat and asked for help because it's hard to ask for help sometimes.
Yes, it is. It's
hmm
really hard. It's also really hard for the helpers. It's really hard for people who, as their profession or as a big part of their identity, when we are helping others as a therapist, as a coach, as a teacher, as a physician, as a mom, as we are helping others, I think it becomes even more difficult to be able to give ourselves permission to ask for that help. So whether we're asking help for how to eat healthier, to move more, that's really, really hard. And I think there's something particularly difficult about asking for mental health help. There's, obviously a huge stigma that I think is reducing, with the younger generation are getting, I think, a little more comfortable with it. But many of us grew up with messages, very stigmatizing messages about only people who are crazy go see a therapist. This idea of a shrink, not really a positive description. So that's really something that I'm just personally really passionate about, is destigmatizing getting into therapy, that it's actually something to be proud of, that, hey, I have the courage to do this. And I'm open and receptive to being the best version of myself. So, very passionate about encouraging other helpers and healers to get that help for themselves.
Yes, again, so well said. And as people are hearing helper and healer, I think you also use the term caregiver a lot in your
Yes.
episodes. And a lot of
Yes.
times people picture caregiver as like caregiving of somebody who's sick, and it doesn't necessarily have to be that way. You do go into this, but like it can be a mom, it can be a profession that you're in, right? Like caregiver
Yeah.
is a blanket statement of you're the one.
Absolutely. Yeah, I
Mhm.
don't necessarily just mean a nurse or someone who is caring for someone who is ill. I work with a lot of women right now, especially who are in what we call that sort of sandwich stage, where they're still taking care of their children and now they're starting to take care of their aging parents. And so that's a huge caregiver role, whether or not professionally you're actually doing any kind of care or help, I think is not relevant. That there are all ways in which we care for others, and with, of course, that theme that oftentimes we care so much for others that we neglect to care for ourselves.
Yes, which is what I want to dive into with some of your topics because I believe that, boundaries is one of them that comes up and resilience, mindfulness. Mindfulness is very hard to do when we're just constantly pouring from an empty cup. So let's tear apart some of these topics. Vulnerability was one, radical acceptance. And I'm going to start with boundaries. You and I share clients sometimes, and I feel like boundaries is one of the big ones that kind of flips back and forth with conversation. And I'll be like, well, what was your and Dr. Bruce's discussion? And we'll kind of go off that from the food and fitness end. But with boundaries, give me a constant conversation you might be having with a client and how you see that it is maybe stagnating. Let's say that weight loss is one of their goals, how you can actually see it really being a roadblock in their journey.
Excellent question, Lindsay. Yes, I swear there's certain topics that I talk about so often with so many of my patients that I often have the thought, maybe I could just sort of tape record this and
Mhm.
just
Hand it to
play.
them.
Like,
Yes.
okay, this is what I said to my 9 a.m. You need to hear it as well. So, boundaries is just such a struggle for so many of us, especially with the helpers, the healers, the caregivers. Is this something that I can do? Do I have the time to do it? So there's this sort of knee jerk reaction. If someone asks me to do something or help them with something, that I'm just immediately and automatically going to say yes because I feel guilty saying no. And so boundaries can look like the mindful pause of asking ourselves, is this good for me? And then setting a boundary that might be just a simple, no, I'm sorry, I would love to, but I really can't right now. That's an example of a boundary. And that if we never do that, if we never say no, if we're always giving ourselves to others, then the pattern that I typically see is that resentment builds up. And when we have resentment, we often then find other ways to manage that resentment or to comfort ourselves. So, one of the classic things I see is all day we're going, 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 giving, giving, giving. And then at the end of the day, when the kids are in bed, the job is over, there's nothing left for me to do, that's when I start snacking and munching and eating. Part of it is biological because we've run all day, we have maybe missed meals or didn't eat very well, but also so much of it is psychological. Like I have not set any boundaries all day. So now here it comes the end of the day. I'm empty. I'm a dry, empty cup. And all I want to do is just fill it back up. And we're usually filling it with food. That's probably one of the most common patterns that I see. So teaching people boundaries, limits, saying no, being mindful and pausing before automatically responding is a huge thing. And when people get better at learning how to set those boundaries during the day, they notice that their resentment goes down and they notice that they're less likely then to engage in those unhealthy refueling in the evenings.
Yes, my goodness. Yes. And if the listeners can hear this, so the refueling that Dr. Bruce is talking about here is, the what am I really hungry for? Hungry for me time and filling it with food, filling it with alcohol, filling it with maybe shopping. I've had clients who sit down to finally read at night and they read until almost 3 or 4 in the morning because they're like, I finally got me time. And then they're exhausted,
Yep.
obviously, the next
Yep.
day. And there's these ripples. Tell me if you agree with this, becomes kind of this starting point of once that one little boundary is broken or multiple boundaries, we've just set off a ripple of how it's going to affect so many other facets of our life, right?
1000%. And what I try to teach clients is that if you are feeling resentful, if you're having the emotion of resentment, then that means you have allowed someone to cross your boundaries. And this kind of veers us into a little bit of a different direction because one of my central tenets, personally and professionally, is empowerment. I want people to feel and to know that they are empowered to make changes in their lives. And one of the most challenging clients for me are clients that will come in and say, these things keep happening to me. My boss expects so much. I can't even ever take 2 minutes for a lunch. I can't even take 2 minutes to pee. And like this idea that all of these things are happening to me, and therefore I'm kind of powerless and a victim to do anything about it. And so to me, resentment means not that people are doing things to me, but resentment is that I'm allowing people to cross my boundaries. Now, that doesn't mean it's easy to set a boundary and to set a limit. It's especially difficult with a boss or a toxic workplace. I'm not suggesting that it's easy to do that, but I think that's a very important mindset shift of victimhood to empowerment.
Well, I also think it's one of the coolest things when I get to work with your people, how we do the crossover. There's been so much of that work that has been done. I normally get them by the point, and thank you, where they're like so open-minded to like, what do I need to do to change this scenario in my life? And it's another beautiful aspect of therapy. I'm like, so cool. And yes, some people are 5 years in, some people are 10 years in, but like they're a new person. They're handling situations 100% different than they ever thought they could. And I even heard this come out of one of your clients' mouth. She's like, I literally had a conversation with Laurie where I was like, that will never be me. And now it is me. And the hope of we really can change, but the work has to be done.
Yes. Yeah. And I emphasize that it's not like any of this is easy. It is
Mhm.
hard and it can be time consuming. I've worked with some clients now for 15 years, but they would say, yeah, that was a huge investment of time, energy, and money, but their lives are just radically different today than they were 15 years ago. So it's not easy. It's not fun. Sometimes it is not fun. It is hard work. But to me, you're investing in yourself. Like, what else do we get to invest in more important than investing in our own well being? I think that's huge.
Yeah, because that investing in our well-being means we get to like ourselves now and like ourselves in 10 years and 20 years. And you and I have both seen this because of seeing how this can go in others' lives. Like it has become radically important in mine to like what happens in the next 10 years. Make sure that whatever groundwork's being laid now, call it professionally or with family or whatnot, that like I don't want to give up things now and think, oh, well. And then all of a sudden, kids launch, graduate, and I'm going, I don't like my career anymore. I don't even know what I want to do. So, thank you for saying that because I think when we're in the moment, we can really feel that we can say, oh, well, we can say, I'm busy, I'm exhausted, and does this matter? And to your point, it is one of the best financial and emotional energy investments we can make.
I really do believe that because ultimately, what is it that every single person wants? Everybody just wants to be happy. We think about different goals. I want to lose weight. I want to get fit. I want this. I want a house. I want a job in this area. Like anything that we want,
Mm,
ultimately, if we dig just a little bit deeper, underneath all of that is I just want to be happy. I
mm.
imagine that if I lose weight, I'll be happy. I imagine if I have this house or this job or this whatever, then I'll be happy. And so to me, therapy is about an investment in your happiness, really figuring out what is going to bring you joy. Is it true? Is it true that that house or that job or that weight loss is actually going to make you happy? And learning how to explore and figure out, yes, in fact, I do think it is going to make me happy. Or no, actually, this is really what I think will bring me joy. So to me, that's ultimately everybody just wants to be happy. And what's the best way to figure out what's going to make you happy in your life is therapy.
I 100% agree. And I think this is a great segue into another topic that you talk about a lot, mindfulness.
Yes.
And you
Yes.
even said it in the boundary conversation, like that word comes up all the time. When you think of mindfulness, I'm going to keep going this route, just like a constant conversation that hit record. I love that vision because
Mhm.
I'm with you. There are some things, and this is why you have a podcast, Lori, is because you can hit the record button and give the topic. But
Yes.
what what's your biggest mindfulness thoughts or wishes for your people?
Mm. So, what I notice is that mindfulness is not anything that is trained or taught. Certainly, we don't learn how to be mindful. in many ways, we learn how to be mindless. That's
Mm.
kind of more the default um, is especially in Western society. I think we're very focused on doing and achieving and acquiring and having. So doing mode versus being mode. Being mode is sort of another way of describing mindfulness, which is allowing, being aware, being present, allowing what is to be as it is. And I think there's so much that mindfulness can teach us. Um, I believe that so much of what drives the doing and the achieving and the striving is the false belief. Once I have all those things, then I'll be happy. And really, what mindfulness teaches us, what the research on mindfulness teaches us, is that actually happiness is available to you at any moment. We're just confused about how we get that. And mindfulness really is about learning how to feel joy in the here and now versus imagining that you're going to get that joy in the future. So to me, as we're talking about this ideas of what's going to make us happy, it's you can't disconnect that from mindfulness and presence.
Yeah, so I'll take this to more of a micro level here for a minute because you used to teach a class at the hospital about Am I Hungry? And you would do this scale of hungerfulness, which was such a good mindfulness scale. And sometimes I think from a surface level, somebody could be like, oh my gosh, this is silly. Yes, 8, I'm hungry, or 2, I'm stuffed, or what, or I think I
Yeah,
flipped your scale.
it's the
But
opposite, but that's
I
fine.
did. Wrong sides. But I just, the more that I've witnessed clients use it and that mindfulness and really learn their hunger fullness cues, to your point, we're not taught a lot of this in life. So this is just like one small example, but in the food realm, do you still use that?
My
And do
gosh.
you feel like you get ahas out of it?
All the time, all the time. I use it myself and I teach this to others. Yeah, at least once a week with some client, I'm covering the hunger fullness scale still today. I do feel that it's essential to learn mindful eating. If we're going to have a peaceful relationship with food, then we really need to learn mindfulness and mindfulness about our bodies and hunger and satiety and discomfort, but also mindfulness of the food itself. You know, the biggest thing that I see is that we are trained to eat quickly. And we also, it's very common in our society to multitask so that we're eating while we're scrolling through Instagram, we're eating while we're watching TV. We're rarely eating and mindfully eating. So we eat quickly, we're doing something else, and the end of the meal comes, the plate is empty, and most of us are like, what did I even eat? I didn't enjoy that. I didn't savor that. And oh my gosh, how am I all of a sudden so full that I feel sick? How did that even happen? And that's really what mindfulness is about slowing down the process, slowing down and paying attention and asking yourself before you eat, how hungry am I? Asking yourself as you're going through, am I feeling satiated before you've already jumped ahead to fullness? And then really savoring and enjoying your food because that's a moment of joy. To have food that you really enjoy the taste of is essential. And so many little moments of joy we can have while eating if we're being mindful about it.
Yes, I literally think of you sometimes, and I'll take my plate of food because I work from home out on my porch and sit in the sunshine and
Mhm.
just leave my
Good for
phone inside.
you.
And it still only takes like 10 minutes when you're by yourself. It doesn't take long to eat, but it is the most like refreshing, refueling 10 minutes. And you realize, okay, I'm kind of full. I have 2 more bites left, or again, I don't know why maybe younger Lindsay didn't give some of that stuff credit and I like keep learning as I go. But I do think this scale for the listeners, if they want a really nice tangible takeaway, it's a scale from 1 to 10. I'll let you explain it so I don't botch it again.
Sure. Yeah, no. So it's essentially a scale from 1 to 10, with one being the most hungry you could be, the most starving, all the way up to 10 being the most like sick. You've eaten
Mhm.
so much you feel sick. And five being our neutral point where we're neither hungry nor full. And so we kind of each, when I do this work with patients, I really literally go through each of the numbers and what does that mean? Because your three might feel a little bit different than my three. So I try to help clients really understand, okay, this is what three feels like. This is what seven feels like. And when you practice this enough, and granted, it might take a year or more to do it, but when you practice it enough, you really can understand the fundamental difference between a seven and an eight. When we are not trained in mindfulness and mindful eating, a seven and an eight, you're never going to be able to discriminate between that. Some people, like, the only thing they know are ones and tens. I know what it's like to be starving and I know what it's like to be sick, but I don't understand any of these numbers in between. And that's part of the work that we're doing, is helping us to slowly become aware of what each of those numbers are, so that ideally we can get to a pattern of what I call like the 3 6, 3 6.5, if we really want to, where we're comfortably hungry and then content at the end, but not stuffed.
Yes, and this just makes me feel like it's that coming out of diet mentality, trusting yourself. You don't need to be told how much, or like you really can listen to yourself and
Yeah.
find some trust there. Yeah, that's so good.
Just was going to add one quick thing that I really appreciate when you said I go out on the porch and I sit in the sun, that you use the words refueling. That even a 10-minute mindfulness in the middle of the day refueled you. So some of it was physical, the fuel from the food, the nutrition, but also that sort of mental refueling by just being quiet and soaking up the sun and appreciating that moment. Those are the things that I think are so crucial, and I just wanted to highlight that.
No, thank you. And I was thinking maybe I'll say this, maybe I won't, and I'm going to say it. But it's so interesting when I'm sitting across from a you who's very calm and and it feels like achievable to carve out time, even if life's crazy or whatnot. All of this feels like easy answers. And then you take somebody else who's not in this mental space and they are going a mile a minute and some of this stuff's laughable. And how do you handle those situations too? Or if somebody's even feeling like that, like this won't work for me, or I don't
Yes.
know, like how do you bring people into this space?
Well, one of the things that I really try to do, some days I'm better at it than others, I really try to meet a person wherever they are. So I try not to get into like a salesman mode about mindfulness. You really got to try this mindfulness thing. What I know about human behavior is when we feel like we're being pitched or sold to, or someone's trying to convince us of something, we're going to be more resistant. So
Mhm.
I definitely take more of an approach of, hey, I'm hearing that this is something that you really struggle with, the fast pace, the feeling pressured, feeling overwhelmed, you barely have a minute to do anything. So I practice a lot of validation so that the person feels heard. And then I might kind of throw in a little, hey, here's something that I've learned that has been helpful for me that maybe would be helpful for you.
Mhm.
And when we take that approach of, hey, here's like a little seed to consider, I say that all the time, just planting a seed, just planting a seed, that sometimes people become a little bit more open to
Mhm.
that possibility. And there's a wide range with clients in terms of receptivity and openness. I have a lot of folks who come in who are very rigid in their thinking and their belief system. And we know that inflexibility is a source of pain. When we have black or white, all or nothing, rigid thinking, you can guarantee there's depression and anxiety underneath that. So for
Mm.
some folks, I even just talk about that concept of psychological flexibility, being more open, humility, openness to being wrong. Like one of the things, even though I don't like the way Dr. Phil does his whole how's that working for you thing, I do a modification of that,
Mm.
which is, hey, I'm hearing the way in which you've been doing it hasn't been working very well for you because that's why you're into therapy. I'm
Mhm.
wondering if maybe we could think about another way of looking at this or thinking about it. And usually just a more gentle approach for those folks can work, though not for everybody. There are some folks that are really convinced that it's the rest of the world, it's not them, in which case therapy is usually not successful for those folks because that's kind of a prerequisite for therapy is you have to be open to doing something different.
Right, right. Yes, no, and that's so hopeful though. I think the meet you where you are is what just like jumped off that highlighted for me because that's comfy. We can be met where we are and we all can continue to move forward and grow and improve. So thank you for that. I love that on your website you host this 5 steps to finding calm in the chaos as we're kind of speaking of different chaotic situations. I would like for you to describe, I love free resources. I think they're a great dip your toe in the water type of moment with professionals where if it makes you so nervous to be with somebody one-on-one, you
Mhm.
can start to use them and just see what it would feel like. What is this course? Because I think that a lot of our individuals could jump onto this.
Yeah. So what I have is a free resource for people to start. It's like an introduction to mindfulness. So I talk about 5 different steps that we can start building our mindfulness practice. So understanding a little bit more about what do I mean when I say mindful? I'm not talking about sitting and meditating, for hours at a time. People have some preconceived notions of what mindfulness is. So I talk a little bit about understanding actually what I mean when I'm talking about mindfulness, and then different strategies to help people incorporate mindfulness into their daily life in small ways. So again, kind of this meeting people where they're at. If you are new to me or new to my work, then a lot of folks have never been taught mindfulness or even know what that is. So I always really try to start small and what are the tiny ways that we can start incorporating this into our lives, even if it's 5 seconds. Everybody has 5 seconds. And so, what could we do of 5 seconds of mindfulness and what might that look like? And how do we benefit from that? Why would we even want to do that? And ultimately, I do feel very strongly that mindfulness is the path towards having more joy, having more peace, and living the fullest life we can live.
Yes. And as I hear you, and as I've looked at your website and your blog and your podcast, my recommendation to the listeners would be to go grab this 5 steps to finding calm in the chaos, because I think that's a great jump off point. I would personally say grab a podcast at least once a week, if not daily, if this is an area that you're trying to really dive into. Plug Dr. Bruce into your ears daily. I promise it will start to make a shift in your day. And then read through some blogs, read through, grab a free discovery call. I just, I keep getting to this point with individuals where I'm like, you're not saying yes to some things that could really benefit. And it's not that you have to do
Mm.
them perfect. You might not finish the finding the calm in the chaos. You might just get around to download it. It's okay. It's just take that next actionable step because
Yes.
until you can see how it's going to benefit you, why would you ever have motivation to keep pressing play and listening? So love having you on here for this. If people are going, yes, I would love to, I'll follow that plan, where should they head to be able to find you?
So my website is drlauriebruce.com, and Laurie is spelled 100,000 different ways, but I spell it Laurie. So it's LaurieBruce, drlauriebruce.com. I have free resources that talk about therapy, about different types of mental health conditions. As you said, I have a blog, I have my podcast. It's called From Both Sides of the Couch. So I'd love to have people check that out. And I also love feedback. I love feedback from folks. So if there are show topic ideas that you would love, I would love to hear that. If you listen to an episode and you didn't love it or you were looking for something different, I really actually appreciate that. I love to get all feedback in a respectful manner, of course. I love hearing from my listeners. Obviously, I'm doing this to help others. So if there are topics that people would love to hear, then I would want to know about it.
Yes, I know podcasting can get a little lonely sometimes if
Yeah.
you don't get the feedback, if you don't get the communication back and forth. So I totally agree with you. All comments are welcomed. You
All
know I
comments
end show.
appreciated.
Yes. I always end this way, but I would love for you to wrap your arms around our listeners and kind of tell them if you hear nothing else, if you walk away with nothing else, what do you hope and pray that they take away?
Uh, well, even though we didn't talk about this, what I hope for all of my clients, for myself, for you, Lindsley, for anyone who's listening today, I just want you to remember that you are enough. There's nothing you need to do, to change, to fix. You're already perfectly imperfect, just exactly the way that you are. And I think when we embrace that and know that in our hearts, then we're happy and we're at peace. If we don't know that, if we don't believe that, that's when suffering and pain occurs. So you are enough.
You're amazing.
Thank you, Lindsay. So good to see you.